All right, today in the Panorama Studio, we are talking all things acupuncture and business with Dr. Sarah and her husband, David Anzola, who founded Templ Wellness, formerly known as Accushin, a holistic integrative medicine clinic in Houston Heights. Dr. Sarah is a doctor of acupuncture and integrative medicine, and David is her co-owner and general manager at Templ Wellness. Originally, Dr. Sarah obtained her bachelor's in human ecology at UT Austin, where she discovered her passion for traditional Chinese medicine, and went on to obtain her master's and doctorate in acupuncture and oriental medicine in Houston. She completed her studies in Tianjin, China, and during this time, she also worked as a trained EMT and birth doula. When she graduated, Dr. Sarah became one of the Houston Methodist Hospital's first lead TCM practitioners, which I love hearing about for a hospital. From there, her and her husband were inspired to open their own clinic in 2021. In their clinic, Dr. Sarah specializes in treating women's wellness, fertility and pregnancy, cosmetic acupuncture, anxiety and mental health, pain management, sleep, digestion, immune support, and more. On the side, David is a pro at branding, design vision, photography, videography, and has really helped create a beautiful clinic space and marketing. Templ Wellness has now grown its team members and services into a truly holistic clinic with not only acupuncture and herbal medicine, but also health and nutrition coaching, facials, massage, sauna, IV drips, and more, which we're going to talk all about. Last but not least, Templ's mission is to be a wellness hub where ancient wisdom meets modern medicine to heal your body from within, and understands that each individual's healing journey is unique. Dr. Sarah and David, thank you so much for making the time to be here today. How are you feeling?
Feeling great. Thank you for having us here.
Yes.
Yeah, that was
a
that
beautiful
was a long
intro.
Yeah.
Thank you.
Thanks
I
so
feel like
much.
I barely scratched the surface, but we got in,
No,
got in a lot there.
That was a
It
mouthful.
was perfect.
That was
Thank
great.
you so much.
Well, I am so excited we finally got both of you on because we've been trying from day one of starting the podcast to get you here.
I know. Yes,
Yeah,
coordinating David's
coordinating.
travel schedule, always out of town. It worked out.
Yeah.
And finally, we're here.
Yes, all in the
We're
right
happy.
timing.
Yeah,
Mhm.
And
exactly.
again, one reason I wanted to have y'all on is because I really accredit y'all to sort of being the birthplace of Wellness for Houston. And I talk about that in episode 1.
Yeah.
So I met y'all through Elise. Do y'all remember Elise?
Mhm.
Yes.
She moved to Colorado. But
I
she's
know.
one of my favorite yoga students, and she had come into my class one time, and she was like, she knew I loved holistic and all the therapies, and she's like, you need to go try my friend's new clinic, Accushin, over in the Heights. And I was like, oh yeah, for sure, I love acupuncture, I'll go give it a try. And so I came over to y'all, and I started coming frequently to work on the different things I wanted to work on. And one time we were chatting because you guys had this beautiful garden in the back.
Mm-hmm.
I miss that garden.
I know, me too.
Yeah,
we
we
want to
all
bring
do.
it back
We all
so
do.
bad. Yeah.
But back when y'all had the garden, we were like, maybe we could combine the yoga I'm teaching with your acupuncture. I had seen it done in LA, and I really wanted to do it here. And you had popped over to our studio a few times to do a third eye chakra needle. And so we kicked that off in the garden. We would do the yoga class, and at the end in Shavasana, you would do the third eye chakra needle. And it was just the perfect combination of like movement is medicine and some healing acupuncture to de-stress. Just so zen. It was beautiful.
It
And
was great.
I know, and we did
Yeah,
that
and we
for
used to
several months.
a lot
And
of
they
people
were
used
sold
to,
out.
yeah,
Like we
it was
had
great.
big classes.
Yeah.
That was our specialty class, and we still love to do it.
Mm-hmm.
Now we'll do it in other spaces, and we'll get help from your other practitioner, Dr.
Yes.
Sebastian. But that was really special for us to get started, and the community and just the vibes of that are really what were our seed for Wellness for Hugh. So I want to thank both of you for giving that to us.
Yes.
Well, thank you
I
for
know,
I
yeah.
think you were part of the inspiration for a lot of that, and
And a lot of other things
yeah,
too.
I mean,
yeah.
we always talk about how you're like our number one fan, and really helped us get the community kind of like together
Absolutely.
for
yeah.
where we are today. So thank you
You
for
are
that. Yeah.
That's
very
something I love
social
doing.
butterfly. And I was actually joking with Dr. Sebastian today, and I said, what would we do without Alexis? She brought us you, essentially.
Mm-hmm.
She brought so many like people, like that are important
Workers
into our
and
lives.
clients,
Workers,
yeah.
clients, friends. So yeah, we both really admire your connection and just like your joyful attitude that you put into the world.
Sweet. Thank
so,
you both. Well, that place, your clinic feels like home. So I love running into, when I refer friends and I run into them there, I'm like, oh my gosh, hi. Like, it's like, you know, seeing a family member on the go. So it's a beautiful community space, and I love that.
Thank you.
Yeah, thank you. Thank you.
So that's a little bit how we met. I would love to hear how y'all met, since you're both here, and then how you got into acupuncture. So tell us a little bit about your story.
Yeah. David and I go way back.
Way back.
Really way back.
Y'all aren't that old.
I know. And it's funny to like tell this story because we're still essentially young.
Yeah.
But we've been together for 17 years.
Wow.
Yeah, since high school. We met in 10th grade.
Oh my goodness.
Through
Yes.
My older brother.
He was my best friend.
He was Sarah's best friend.
Yes, yes. And yeah, so my best girlfriend at the time introduced me to his brother Lucas, then introduced me to David. And I mean, honestly, since we met, we were kind of inseparable. Like, we just like fueled each other in such like a positive and supportive way. From high school, we did long distance. David joined the military. He lived out of state for 4 years. So we had 4-year long distance relationship.
Wow.
5.
Okay, 5.
I was active duty for 5 years.
He knows, yeah,
5 years,
he knows better.
He remembers.
He
was away from you.
remembers, yeah. And at that time, I went to school and started at U of H. I was on the dance team there. Then I went to UT, and thank God for Austin. That's where I met everything natural and holistic, and it really, that is what changed my path in my life and my career. And then came back, and we were like, hey, we've been together for a long time. Let's get married.
Aww.
And started like so many adventures after that. He started his own company.
Yeah.
The same year we got married. And then I was in acupuncture school. So it's just been a lot of growth since then, really.
Aww.
Yeah.
It's been a long, college and military. And then I went to college when she was going to get her doctorates and started my own company doing photo and video production. And then she was still going through school, and then got out, started working for the hospital. And then I was like, get out and do your own thing. And then we kind of started Acupuncture Clinic. And then from there, well, at first it was Humble Acupuncture.
Yeah, that was the name that I chose. But David is way more creative. So since then we have evolved.
Yeah, I always wanted to do something different. But after that, Acupuncture Clinic was born. And then I guess we can touch on that later. But, you know, we then rebranded to Templ.
Yeah. Well, I did want to say thank you for your service, because I know you did.
Thank you.
Do the stint in the military. And I love that you guys have been together so long, because it really shows how you have a strong foundation and are able to work through obstacles. I think that's really important when you share a business together.
Yes.
So that's amazing.
Thank you. Yeah.
Thank you.
Yeah.
It's been an amazing journey.
Yeah.
I think it's been really cool to see us grow.
And while I was in school going back, I actually used to help David in his business when he launched it. I was his admin person. So we've always kind of flipped roles. Yeah, he had an office in what is that area in the Galleria? Highland Village. His office was there before Highland Village was Highland Village.
And then I moved to downtown. But yeah, you used to design
and I was
the
his
albums.
admin person. So I used to go into work. I'd respond to all his inquiries, and then I'd go to school. So we've definitely like just flipped back and forth between, okay, it's your business. His first wedding he did paid. I was his second shooter. I was a photographer. I did photo and video.
We had like little walkie-talkies and it's pretty funny.
Yeah. So we've definitely like flipped back and forth between like, okay, it's your business, let's grow your business, and now it's mine. And it's just different seasons of life, but
a true example of being able to grow businesses as a couple. I love that. Y'all are quite the powerhouse.
I think it's imperative that, you know, your spouse or your significant other supports you, because like that's a huge help. So she's been amazing at helping me with my company, and then I think that I have to also, well, I'm I love branding, everything branding and business development.
You're really
so
good at
that's,
that. Mm-hmm.
Thank you. Yeah. So I've enjoyed everything about Templ for sure.
I love that. So Sarah, you said a lot of your inspiration for the holistic realm started when you were in Austin.
Mm-hmm.
And so how did you find acupuncture? Like, you were into that realm, and then how did you find acupuncture and decide to go to school?
Yeah. So since I was 5, I like to go back to the story. I wanted to be an orthodontist, and I was set to go to dental school. Like, my whole family knew it. I said since I was 5. I meant 5th grade. So sorry. In 5th grade, a girl got braces next to me that sat at the desk, and I remember very vividly falling in love with this structure in her mouth. And so, in high school, I started kind of shadowing dentist, and then my route to UT was pre-dental. So I was in the pre-dental club. I was super active in that, shadowing dentist. For sure, I knew I wanted to be in the healthcare field. Well, there was one moment where I was shadowing a dentist, and a lot of blood was coming out of this patient's mouth. And I just really I remember calling David because we were long distance, and I was like, I don't think I can do this. I know I said I always wanted to do this, but I'm also studying nutrition, and I'm starting to think about, big pharma, and I'm really questioning like the way that we eat. And I've watched a lot of documentaries about like organic food and how it's important for you. And so I had mainstream medicine, which was always my route, clash with this new information that I had received, because at UT it was everything natural, everyone's so open-minded in Austin. And so it just, my world collided. And during that phone call, David was like, well, you have to figure it out. From there, because it was like definitely a tough love thing. Like, you have to have a career, and you have to also be able to financially take care of yourself. And it's great that you want to do holistic stuff, but you got to pretty much prove that you can do this financially, make a career out of it. So from there, I remember calling all kinds of professionals. And if they're watching this, thank you so much, because they really launched, my journey into the holistic healthcare field. I met with naturopathic doctors one-on-one. I'm like, can I please just come in? I'm a college student. I have questions for you. I don't know what to do with my life. I have an idea, but I need support and guidance. And these people gave their time to me free. So like for that, I'll forever be grateful. But I met with naturopathic doctors, acupuncturists, over the phone with holistic dentists. And I'll never forget, a holistic dentist told me, he said, look, I love that you want to combine both, but if holistic medicine is really your passion and you go to dental school, do not tell anybody that you want to do holistic wellness, because you won't get accepted, and they will try to push you out of the school before, you're even successful in it.
Dang.
He was like, he was based out of San Antonio. He was like, it has to be on the low key. Once you graduate, then you can be open about what your intentions are with focusing in holistic dentistry. He was like, but right now it's not supported in dental school. And so for me, that was like really eye-opening of like, I need to for sure switch my career. And anyways, I fell in love with acupuncture, and a girl that worked with me was also in acupuncture school. It was just a coincidence. I worked at a laser hair removal spa going to school, and she gave me a Web Without a Weaver book. And that book introduces like TCM theory and acupuncture, and just like the very basic of that medicine. So from there, I said, hey, David, I found there's a school in Houston, so I can move to Houston. You can get out of the military, go to Houston. We can get married. I can go to school
wink,
there.
Yeah.
And one of the big reasons I chose acupuncture school is because I could get my license with the state of Texas Medical Board. And naturopathic doctors cannot be licensed in the state of Texas to practice. So that really was like, okay, defining answer.
That's a good point.
Yeah. They and when I learned that when I met with them in Austin, that they have to operate more as therapists or as counselors. So they counsel people based on their health, but they don't have any. They can't diagnose. They can't treat. They can't prescribe. They can't touch the patient per se.
At this point, had you tried some acupuncture for yourself as well?
No,
Wow,
which is funny,
that's crazy.
which is crazy.
That you just knew.
I just knew. Well, I wanted to focus on herbology. So the reason why I picked the school, state of Texas, you have to study acupuncture, herbal medicine, Western medicine, and like TCM Foundation, like Chinese Medicine Foundation. And so I wanted to be an herbalist. That was my career path, which has since then changed because acupuncture is more mainstream. So it's a little bit easier to practice acupuncture and make a career out of it than be an herbalist in the state of Texas.
But you still
But
are able to practice.
I practice herbal medicine. So acupuncture is more like primary for me as what I treat my patients with. And then herbology is secondary and complementary.
I love that.
Yeah.
I wanted to take a moment to shout out one of my favorite herbal brands. It's Arrae, A-R-R-A-E. So when I started going to acupuncture a few years ago, I started learning more about herbal remedies. And Arrae has some of my favorite simple ingredient blends. The two that I'm obsessed with on the daily are bloat and calm, which are two things I often go to acupuncture for to reduce stress and stress-related digestive issues. So the bloat capsules have 6 organic herbal compounds: bromelain from pineapple, ginger root, lemon balm, dandelion, peppermint, and slippery elm. And the calm has L-theanine, inositol, magnesium, and passion flower. Amazing. Love those. You can find these individually or in the frequent flyer holiday gift set that I've got here up on the table because I just got mine in. It's the perfect wellness girly gift. And Arrae always knocks it out of the park with their beautiful branding. So go check out their website using my link for 15% off. That's arrae.com/AlexisM15. Spelled out, that's ARRAE.com, ALEXISM15 for 15% off. I'll also link it in the show notes. Just to tell the audience, for who may not know, what is acupuncture? Like, how would you describe it in a few sentences?
Acupuncture is ancient medicine that includes using thin needles and inserting them into acupuncture points, which are connected to energetic pathways which connect organs to different parts of your body, and it's used to rebalance, heal, and treat an individual.
I'm obsessed.
Yes.
Yeah.
It's like the shortest way that I can explain it because, there's ways that we can explain it, from like evidence-based medicine with, a lot of research on how it works. And then ways we can explain it like from Eastern philosophy. So I guess that's the short.
Maybe touch on the chi because that comes up a lot.
Yeah. So what acupuncture is doing when we put the needles in, it's moving chi and blood throughout the meridians in the body. So chi is an ancient, philosophy, or another word for energy. So chi is always connected with blood. It's the energetic movement of blood. So it's the movement that drives the blood through the body,
Yeah, like when you put in a needle, if you wiggle it a little bit, you'll feel the little energy move.
Like a little ding. Yeah. Yeah. I needled a patient yesterday and she said, "You needled me," and it felt like, I had like movement, like something was tingling and moving, and I felt the chi moving in my body. So it's fun because there's so many different ways you can feel it. But
I've felt it too. Like whenever I was going through like severe anxiety post military life, and I was starting to get acupuncture while she was in school, I would feel it, like, because there's points in the chest to kind of like calm you down and just allow you to breathe better. I would feel like little like shock waves on my chest, and at first I was like, "Gosh, what's happening?" But the doctor at that time was like, "That's actually your energy is flowing, which is great. Like those feelings that you're getting are positive." So, and now it's done wonders for me.
I
which
love
is amazing.
that. Yeah, did David become your guinea pig to practice on?
During school? Yes, and I think I may have caused a little bit of trauma.
Yeah, she would come from school and she was like, "I think I want to try this, I want to try that," and yeah, I got a lot of pokes.
Sarah gets the needles
Yeah.
out. David runs away.
I
It's
know,
amazing
yeah.
that, like,
That's still sometimes our story because
Yeah.
he was my guinea pig in school, and one day he was having like an acute anxiety episode, and I was like, "Hey, I just learned this point in school today, and it's gonna help you. Will you let me do it?" And he was like, "I feel miserable." Okay, yeah, just whatever. And I did it, and it created like an electric shock,
Yep.
which
like
was
not a very and it was new to me.
it was-
so
Yeah.
it wasn't very pleasant, like in the middle of an anxiety attack. And I was like, I am never getting that again.
But after like 5 minutes, he calmed down and the
Yeah.
anxiety episode went away. So it was very effective. And he was like, I feel better, but I never want to do that again.
Yeah.
But, you know, I also didn't have the technique that I have
Right,
now.
yeah.
Much
I do have
gentler,
to say
yeah.
now, like, obviously 6 years of school after, and
Yeah, that
now
was over.
obviously all the
That was 10 years
experience.
ago.
Yeah.
Yeah.
Her technique is amazing.
Yeah. Speaking of school, to your point, how many years of schooling did you do for master's and doctorate? And how is that different? Let's talk about how that's different
Yes.
from dry needling, because there's differences. You want to look for a licensed acupuncture who's gone through significant schooling. So touch on that.
Yeah. So I was in school for 6 years.
Wow.
Yeah. So I did 4 years of a master's degree and then 2 years for my doctorate degree. So, I mean, quite a long time.
It's like
a
almost
very
a
tough-
doctor level. I mean,
Yeah.
you are a doctor, but
Yeah.
you know what I mean? Like,
Yeah,
it's-
medical
if you went
doctor
that route
compared.
or this route, it's
Yeah.
still significant.
Yeah.
Yeah.
And then training in China, you know. So, yeah, it's very challenging. It's not an easy school, but for anyone interested, I highly, encourage it because I've learned so much to be able to help myself, help my family, heal other people, change people's lives. But it's a very challenging journey. And it's different than dry needling because dry needling is, what did you say?
Well, from my short research, I'm no
program is-
expert, but it's around like 24 to 48 hour
that's-
course.
Wow.
It's like a certification, so you get like a certificate, and there's certain practitioners that can do it, like
Like
Yeah.
chiropractors.
Chiropractors, physical therapists.
physical therapists.
So it's more like taking, like a course,
yeah,
to just have the knowledge, maybe like some CEUs or like a
it's like continuing education.
Continuing education.
But it's not like a sole focus of
Yeah.
education, like 6 years. It's like
yeah, and
some of them I've seen that they're a week long with like practical courses, but a week as opposed to 6 years is very different.
Yeah.
And so I know we chatted before the episode too, but if someone's had a bad experience with maybe dry needling through a different service provider, to look specifically for the licensed acupuncturist
yes.
and try one of them. Like, don't give up yet.
Yeah.
Don't give up yet.
Yeah, it's
Right,
very
yeah.
different.
Yeah, it's very different.
So dry needling is based on trigger points. So it's not meant to be relaxing. It's meant to stimulate a trigger point so that it can then have a reaction. Oftentimes it's used for pain or,
Like
in
muscle
PT,
muscle recovery, things
muscle
like that.
recovery.
Yeah.
And so they want to stimulate the trigger point. So the needles are different. They're a little bit bigger, a little bit longer. But acupuncture is based on a diagnosis. And so once we have a diagnosis, then we use a combination of points to then treat that person. And the acupuncture needles we use are very thin, very gentle. Most people don't even notice them. So it's meant to be relaxing.
Asleep. Yeah.
Yeah, it's
I
meant
fall
to be
asleep.
relaxing. And I'm not trying to elicit a response by the muscle.
Right. And I guess some of the feedback that we've gotten from new patients, just because I'm like behind the patient experience, when a patient comes in and they say that they want to try it again, they've had a bad experience with acupuncture before. After we ask several questions, we find out that they haven't gotten acupuncture, they've gotten dry needling, and it's two different, very different techniques, very
Modalities,
different modalities. Especially because the easiest way that I've heard it explained is that acupuncture it's meant to decrease blood flow. So
Decrease or improve?
increases blood
Increase.
flow,
There you go.
decreases inflammation. So
Decrease inflammation.
it decreases inflammation, increases blood flow, and correct me if I'm wrong, but most diseases are caused by inflammation. So
Yes.
when you
That's a
can
good point.
decrease inflammation and increase oxygen to the body, you can, heal many, many different things.
Definitely.
Yeah.
So let's talk about some of the things you can help with. I know
everything,
right? Yeah. So definitely stress. That's kind of, we can tie that into what we've just been saying. I come a lot of times for stress. If my stress level gets too high, it starts to impact other things in my body, like my digestion. And so I love coming if my stress level has just gotten way too high, and you can needle me and I will fall asleep, and it's luxurious and it's the most calming thing. So I love it for stress, like, period. I think anybody can use it for that.
Yeah, I completely agree with that. I think for stress management, even before you get so stressed, just like having it as a lifestyle. And that's what I tell a lot of people. Once you try acupuncture and you feel good with it, it really becomes a lifestyle, you know?
Yeah.
And so just keeping up and using it like preventatively for stress. But I mean, stress and pain, back pain, migraines, any kind of pain, hormonal imbalances, fertility, sleep is another big one, digestive. So I tell people anything that you would go to CVS and maybe buy like over-the-counter medicine for, you can get acupuncture for. Just
I think even
anything.
more than that.
I
think so. You
more
go to
than
the doctor
that, yeah.
for, period.
Things that you go to the doctor for. So it can be simple things like the CVS example, or it can be more complex things like if you have a medical diagnosis and it's something, I have a lot of cancer patients, that I'm working with, and some really complex, diagnoses. So from the whole scale. It can be for anybody.
And I always tell people too, all the way from the physical to the mental, emotional. So like stress would be an example, and anxiety of the mental, emotional, and then physical, like the pain and maybe even digestion, because you can feel that. So for me, again, I agree. I've definitely come for back pain or even neck and shoulder tightness, right? Like general tightness from working all day, bad posture, sports, whatever that may be. And then my favorite thing also is hormones. I would say that's maybe even how I really got into it, was I wanted to work on getting my cycle back when I got off my birth control. And so acupuncture helped me with that and helped me kind of rebalance my hormones and stimulate them, because they were, dormant for the time that I was on the pill. And that's helped me a lot. And I love it for that. And in addition, you made the point, like, in addition to just balancing hormones and alleviating symptoms of different things like PCOS, maybe even like endometriosis, you can help with fertility, which is like a different side.
Yeah.
You have a lot of clients for that, I imagine.
Lot. I primarily see fertility in women's health. Yeah. And, my background is as a doula.
Yes, I know.
So I don't know. I'm interested in so many things. And when I was going to acupuncture school, I remember it's a very slow-paced medicine, and it's very much it's just beautiful. It's a beautiful medicine. And so I remember telling David, while I'm going to acupuncture school, I kind of want to learn a little bit different side of medicine. So I studied EMT. I got my EMT training. I rode along in ambulances, and I did that for a little bit. And then I also came across, while I was in school doing EMT, we learned about like delivering babies, or not delivering babies, but like in case there was an emergency, like what would we do? And I just kind of became obsessed with that, to be honest. I started watching a lot of YouTube videos on like, okay, if this ever happens, how would I help a woman deliver a baby? What does that even look like? Because I was so unaware. And that really,
as I feel most of us are.
I was like, how do you
even considered being a midwife?
I considered being a midwife and pairing it with my acupuncture studies. I told David, well, I have a few years left of acupuncture school. What if I become a midwife and I join best of both worlds for me? So I was very obsessed with that. And then I found what a doula was, and I saw, hey, there's a doula training in Galveston. I'm down, and I signed up for it. And since then, that really like launched women's health for me.
And what is a doula?
So a doula, a doula is a support person for a woman who's pregnant, going through her journey, needing support with labor and or postpartum.
I feel like I'm gonna need you.
Yeah, I know.
She's amazing.
I know.
Yeah.
Oh my gosh. I highly recommend a doula for anyone who's pregnant. I think it should just be a must. I think insurance should cover it, and doctors should assign a doula to every single person,
amazing.
almost like
amazing.
a caseworker.
Not just for the mom, but for the dad too.
Or
like it's really great.
the partner.
Yeah,
for
educationally.
the family, for the siblings. So a doula, you're all about empowering that person. So it's birth empowerment, and the biggest piece of what a doula does is educate. So she educates the pregnant person and their partner and or the siblings, and says this is what is going to happen, you know, with your body as you grow in this pregnancy, and these are the standard protocols in a hospital. You can say yes, you can deny. These are your rights.
Wow.
These are your options. If you don't like that, you could
Very informative.
And we
use
created a
midwife.
birth plan with her, and we kind of, you know, wanted to stick with that and what were our options. And I felt a lot more comfortable and confident going into it, because, you know, as a new parent, you don't know what's right, what's not, and you have so many opinions from family members and different experiences. And so a doula is kind of like a neutral person that's not only there to like support you, but also educate you. And I feel like as a dad, I feel like that was any dad or any you know, any that's
confident.
doubting it. I feel like it's amazing.
Yeah.
Having a doula, it's absolutely worth it.
So it gives you the best chance for a positive birth, and I think that's the goal.
She even gave me like a break that morning.
Yeah,
like
says,
they're
hey,
there to like also like alleviate, like if dad's there all night or whatever, you know, like then I can go get breakfast for all of us, and then like she was
they're great.
It was amazing.
They help you with
it was
breastfeeding immediately after. Just a lot of bonding, and then they check on you a week after and make sure that like postpartum wise, you're okay. Yeah, so we rule out kind of postpartum depression, and then we process the birth story, which is so important. You know, a week after, while everything's fresh, like talking about what you liked, what happened that you wanted, what happened that you wish didn't happen, and just like making you okay with that. And a lot of women don't do that unless they have a doula, and so if they don't do that, oftentimes I see them later as patients, and you know, depression or like little bouts of anxiety arise, and I can sometimes find out, oh, it's tied back to your childbirth, and so then we have to like kind of go back a few years. So I highly recommend it. It's very, very, very beneficial. Yeah,
that's amazing.
Yeah,
I feel like a lot of women needed to hear that, and dads.
And dads. Yeah,
I feel like a lot of couples will look for a doula to mainly support the mom, but I think that it's for both.
It's for both. Yeah.
So if someone is coming to the clinic, can you kind of like walk through the process of what that looks like the first consultation, everything that you cover, because it's very holistic. Yeah. So talk to us about that if someone wants to go.
Yeah. So if someone wants to go for me, which is acupuncture or herbal medicine, we talk about their symptoms, any medical history that they may have. We talk a lot about like family history, kind of looking at genetics. Did anyone else in your family have this? And it's really an investigation. And then from there,
based on their goals,
based on like where they are, where they've been, and where they want to go. That's what I tell people. We kind of talk about past, present, future. So it takes, you know, a good 30 minutes at least, just to, if not more, to cover that. And then we come up with a plan for them, and then we do the acupuncture, herbal medicine, or I refer them to maybe another service that we offer in our space.
You can also do the cupping.
Yeah, we do the cupping, which is wonderful for anyone who has tight shoulders, tension, anxiety, stress, pain.
Yeah, or they need muscle recovery. A lot of athletes, a lot of sports. You know, for sports medicine, I think
what's the best time of like a woman's cycle to get cupping?
That's a great question.
So I feel like I come in first, but like if I need like blood flow, I think I come in like maybe a week before, like luteal maybe.
Yeah. I guess it would just be really any time except for when you're bleeding.
Okay, good point.
Yeah, because if you're ovulating or you're in your follicular phase, you're working out, you feel great, you know, you might want a little bit of cupping to help support those higher energetic you know, sports activities that you might be doing. And then in your luteal phase, like a week before, we have PMS, tension. That's often like the time of the month that our energy gets stuck. And so cupping's really good at moving the chi.
I think
moving
that's when
chi
I
and
crave
blood.
it. Yeah.
And so it just really helps you to take a load off and feel less hormonal, have less PMS symptoms, and also stimulate the cycle to come.
And what's the difference in the colors of the cupping? Like if it comes out kind of just, you know, the pinky skin color versus like a darker purple spotty?
Yeah, great question. So the pinky color means that there's healthy blood flow. So usually it's like no concern. But if it's on the darker scale, then you just have a lot of tension, a lot of stagnation from chi or blood. And then if it's really pale and there's nothing, you're deficient, and so it's a good sign. Hey, we need to work on diet, quality of food, make sure you're pretty much eating enough, and that blood flow is that you have enough.
And we have like these heart-shaped cups.
Y'all do have the heart-shaped
so like
cups.
normally you'll have like circular bruising or marks, and so these heart-shaped cups will leave like these little hearts
just
on
make
the
the
back,
world a
which are
better
really,
place.
It's so
great.
good. And so I offer it, and then it's very like customized. I just kind of pick up like how my patient is, how they're feeling, and a lot of times if they say, hey, I want the heart cups, then I switch it to, hey, let's do a mantra and let's dedicate this cupping session to self-love. So how are ways that you can love yourself a little deeper, a little better? So that's the hearts are
like
fun. It's like it's a sign. You look in the mirror and you see hearts on you. It's a little reminder that you loved yourself and you're taking care of yourself.
It's
and
beautiful.
Yeah, and you know, like where you were asking the color in the bruising and all that. It's more in depth than just suctioning the muscles. So I think it's also important, like we were talking about, finding a licensed acupuncturist to do acupuncture. Licensed acupuncturists are also very knowledgeable about cupping because it is a TCM modality as well.
So
piggybacking off of that, it's because we diagnose our patient and then we treat them accordingly. So there's different acupuncture points on the back, and so when we do cupping, we use certain regions to target their diagnosis to improve their health.
Speaking of diagnosis, I think the two things you almost always check when we come in for a session is pulse and tongue. So do you want to talk about what you're what you're looking for?
So pulse, we're not counting beats per minute. We're feeling the quality, how the blood and the chi is moving throughout your body. So there's 27 different ways that we can feel a pulse.
Oh my goodness.
Yeah, so we feel, I have to say,
Crazy, right?
I don't think we have time to cover all 27.
Pulse diagnosis was one of the hardest things to learn in school because you only have so many people to try on. But then in China, I had a lot more. But you feel like different depths, strengths, and the widths of the pulse. It's very in depth. And then the tongue is a muscle we can see on the outside of the body. So we're looking at the color, the coating, the shape. And there's different regions on your tongue that connect to different organs. So, for example, like the tip of the tongue connects to the heart. So if someone's very anxious or very stressed, usually the tip of the tongue is red in color. And so it's just a confirmation of diagnosis. Like, okay, this is what I perceived. Your tongue and your pulse match it. So for sure, I can now diagnose you with XYZ.
I love that.
So and your tongue will change.
It changes.
Every time you come in.
It's
you're usually
amazing.
looking for like the coating on mine. If I'm saying like, oh, I'm having like bloating and digestive issues, you'll be like, well, I do see some like white coating, which can be a sign of dampness, I guess is the word we usually say. So do you like tongue scraping? Like I usually tongue scrape in the morning now, but is that taking away the symptom for you to see it?
I know. I love that. That's so cute.
Y'all should sell tongue scrapers.
We should sell tongue scrapers. Well, I always tell people, if you're coming in for acupuncture, just please don't scrape your tongue before, because then it changes my diagnosis a little bit. I have a harder time to confirm, the dampness in your body. But it's okay. Yeah.
You can still tell.
You can, yeah.
So
I don't knock tongue scraping though.
Yeah, I like it. I like it. It makes me like a fresher breath.
You feel cleaner. Yeah.
So y'all really started all around those modalities: acupuncture, herbal medicine, cupping, and then you've expanded your services and you've changed the name. So talk a little bit about that journey. What you've added and why you changed the name.
Yeah. So I think initially when Sarah got hired on by Methodist, we kind of saw a gap that needed to be filled within the traditional Chinese medicine field. And while it's amazing that Western medicine is integrating a lot of like traditional Chinese medicine and more holistic modalities into the hospitals, I feel like it's still a lot of limitation as to what she can do with her license. So she's able to do so much more with her under her scope of practice. And so I think my whole idea was like, well, let's help people with you know, she was really passionate about helping people, so I was like, let's get you out of there and let's start something where you can actually, you know, use it to your advantage. So we started Herbal Acupuncture, and that was you were just renting a little space.
Yeah, I worked with a midwife, so I rented a space in her
like
office,
a little room, yeah.
which was perfect because that was my passion too, was women's health. Yeah.
And then from there, she started getting a lot of clientele. So we saw the opportunity to grow. So we found, no, first you went to a chiropractor's office, right?
After that I went to chiropractors in
so
Keywood.
that's how we grew from there. So then she had her own acupuncture room that she would rent. Yeah, and I had
2 rooms, so it was a little bigger space.
Dedicated just for her. And that was how AcuShen Clinic started.
That's how
and it was out of just like a chiropractor's office. It was just a room.
Start somewhere.
Yeah. And then from there, clientele really started flowing in. Especially because chiropractors have a lot of patients that, you know, deal with pain, and
we referred back and forth.
So it was great.
It's a good combo.
Yeah. For anyone getting out of acupuncture school, highly recommend it. It was great.
Yeah.
Oh, okay. Yeah.
And then from there we found a space in the Heights, and that's where we created AcuShen Clinic, the whole clinic. So the initial idea was to have a space where we could provide traditional Chinese medicine focused modalities to the community. And we quickly found out that people that want acupuncture, they're looking for a lifestyle, right? They were asking for more. So they wanted the acupuncture, but they were also, because a lot of our patients come in to us, unfortunately, as a last resort. They've already exhausted a lot of their options through various other medical providers and places, and so they come to us wanting to find answers. And so they're not just wanting to try one thing, they're wanting to try anything to make them feel better. So from there we found that they wanted acupuncture, they wanted the red light therapy, the massage therapy, nutrition, functional medicine. And so as we started seeing our patients' needs, we began kind of expanding our services, and our service lines became a little bit more broad. We brought on first a functional medicine practitioner, and then from there it just started growing.
And changed the name.
So we found the name. Because AcuShen was created from acupuncture, and then Shen is the spirit, in Chinese medicine. So from there we decided, well, AcuShen was more of a brand that focused on traditional Chinese medicine, so let's focus on a brand that really caters to people's like holistic wellness lifestyle,
mind and
right?
body.
And so after a lot of research and, you know, legal hurdles and, you know, having to make sure that like everything was clear with trademarks and everything like that, I came up with Templ. You know, first it was obviously Templ, the full name, but you have to be creative in order to be able to have like a brand that's unique, that can be, you know, trademarked and brandable. So
we could have a whole episode on all of the background work.
Oh my gosh.
That was quite the journey, but
I think what was meant to be though is what became.
Yeah, for sure. So
and we definitely let's talk about some of the other services. I would love to have some of your other service providers on, like Devin, your functional nutritionist.
They're amazing. All of them. They're so good.
For sure. So we'd love to have some of them on. So you do have both the health coaching and the nutritionist, right? Kind of like both levels for the lifestyle support and diet. And then the massage therapist, you guys have 2 right now, which is great. And what kind of massage are they?
So Ryan focuses more on like medical massage. He also does lymphatic and cranial massage. He does a cranial therapy mixed with massage. And then Lita focuses more on women's health. So she even unlocks and opens your womb to help support fertility. She does pregnancy, postpartum, also just hormone balancing and cranial massage.
I've been trying to get into her.
Yeah, she's phenomenal. Yeah, she has a lot of experience working with women.
We try to offer like it's not just massage. You're going in for like an experience, right? So like our massage is not just just like any massage. We can customize it, and we have a lot of specialties behind the services so that like people can really benefit not just from massage but like really just heal holistically.
I love that.
Yeah,
and the sauna and the IVs.
We have the sauna, so we have the red light sauna.
Yeah.
We have one of the only full spectrum red light saunas in infrared saunas in Houston. So a lot of infrared saunas right now that you'll find they're far infrared. Ours is near, mid, and far infrared. So the infrared is able to penetrate a lot, a lot deeper into your body. And what it does is, as opposed from a regular sauna, an infrared sauna heats you from the inside out. So it's a lot shorter sessions because your organs heat up. You start sweating a lot faster. You detox a lot faster. And in addition to just the infrared in there, we also the sauna has red light therapy, and the Himalayan salt. So which works amazing for respiratory system.
And I love to do that on like a reoccurring basis. But we are entering winter, as wintry as we can get in Texas, and so that's one of my favorite times of years to come do the sauna because you won't sweat as much outside and all the things.
Right.
So
you get all the benefits from the sun without the blue rays.
And speaking of red light, I did want to touch on the acupuncture facial because I would come in like monthly for it. I loved it because it combines acupuncture, gua sha, and the red light. So talk about that.
I actually did one for David yesterday.
And it was
I really wanted to come today before, like, make me glow before the podcast.
It was amazing. Because I forget.
Is that your first time?
No, it was my second time. But I forget like how much we've worked on these services. And I just needed like I guess some self-care time. And I wanted to just get a facial. And I forget that our facials are so in depth. Sarah has worked really hard also to make sure that like people are treated like holistically. So whenever you go in for a facial, you're treating the skin like throughout the whole body. So she also does body acupuncture to make sure that like in session. So that whatever your skin is going through at the time, whether it's diet-based issues or stress, she's working on that stress or that digestive issues so that like your skin can heal a lot faster.
That's incredible. You literally cannot get that anywhere else in Houston.
Nowhere. It's amazing. You could probably explain a little bit more.
I would love to have it done to me.
I keep telling Dr. Sebastian he needs to go get certified to do it for you.
You need to teach me.
I know. I've tried to do it to myself. It's not as relaxing, but still effective.
It's kind of like a natural Botox is what we've called it before too, because you can do the lifting points.
But I say it's like toxin-free.
Toxin-free.
So I have two different ones. So one is focused on just like general skin wellness, body wellness, getting a good glow, working on minor wrinkles, on maybe a little bit sagging skin, dark circles. And then I have one that's the facelift, the natural facelift. And that one I went and I trained and I got certified in California for. I did a whole year of training. And that one is more, it's a little bit different, but the needles all point up, and so afterwards you feel like a nice tightening and pulling.
It's amazing. Like when you see the pictures and when you hear what the patients say, they feel like they got like Botox because
it's incredible.
Because they feel their skin tighter and lifted.
Really good before a wedding too.
Crazy.
Yes, I have a lot of patients transitioning off of Botox, or they say, "Hey, I'm not connecting with that in my lifestyle anymore," and then we do that service, the acupuncture facelift.
It's great, and the red light therapy added onto it,
and the cupping and the gua sha.
We even do the
I do scalp
cups.
massage and neck stretching now. So it's very in depth, and I think one thing that's most important is I do facial mapping. So when they come in, they tell me, "Here's my wrinkles, here's this," and then the face is a map of your life, of your journey. So your grief, your pain, your joy. Everything, your digestion, I can map it out on your face. So I've definitely made some people cry. not intentionally, but by
Yeah.
telling them, I see this in your face based on your story. This is what it's telling me. And it's always spot
People
on.
are amazed.
Yeah.
It's crazy.
I've definitely cried in your session.
This medicine is, I feel
In a
like
good
it's
way.
amazing.
A good
You can-
A good cry.
Yeah.
Mhm.
Yeah.
You can look at the tongue and you can tell so many things. You can look at the face and you can tell so many things.
Yeah. It's a story. And I
Yeah.
think that's what we're trying to do versus
Yeah.
mainstream medicine. We're not just treating symptoms. We're trying to really, treat you on a deeper level.
Well,
And have our
yeah.
patients be heard, and like for us to really, I think the patient experience that we want people to have is to really like have a practitioner that can sit there and listen to them rather than wait for the doctor to come in and then just prescribe you a drug and then just leave and you just see them for 5 seconds.
This is like significant time spent.
Absolutely,
with the
yeah.
patients
And I
where you
think that
feel
that's what our
seen and
community
heard.
wants,
Yeah.
Yeah,
and,
definitely.
And everyone really appreciates it.
Yeah.
People definitely need to come in and experience what we're saying so they can, feel it for themselves or find
Absolutely.
someone near them.
Mm-hmm.
So definitely do that. And
Yeah.
then do you guys have any future goals for the business
There's
We
always
have-
future goals.
that you can
Yes.
spill the tea on?
I know. We have a lot of goals. I
Yeah.
think one goal that's always been consistent over the years is having multiple locations and or a retreat center. So a retreat is something that I've always wanted, and wanting to keep it close to the city. But recently we've been talking about maybe having this retreat outside of the United States.
Ooh.
So that's something to spill the tea on.
Yeah.
But of course it takes time.
It takes time.
Yeah.
Well,
Yeah.
one of our goals is to eventually host a retreat. So if you guys open your retreat center, we'll
Okay,
host our
we'll host
retreat
it,
in
yes. Forever will be
Yeah.
intertwined.
your yes.
And it's because a lot of people that come to us, they're looking for like a lifestyle change, or they really want to broaden their current lifestyle. And so taking them onto a retreat where we can give them everything that we give them in clinic, but have them disconnect from their current lifestyle, whether it's work or a toxic environment or whatever it may be, taking them outside of that and just really having them look within and find a little bit more about themselves. I think it's great, and come back fully refreshed and renewed. I think that's our goal.
Yeah.
Two really special things I want to point out is that I've talked about this on previous episodes, but what I love about acupuncture and certain modalities like massage is that you can really disconnect, to your point. Your phone has to be down, you have needles in, you can't really move. And so you literally just disconnect and take some time for you. Again, that self-love, self-healing. And so that's one thing I love about it. If people just need something to help them disconnect.
Yeah.
And then two, I also love that you and Dr. Sebastian are on the younger side. And so I really like that as a client, because I feel like you can relate to what I'm saying when I'm like, this is what's going on, my past, present, future. And so again, that's a niche for your community, because before younger people started getting into this medicine, a lot of the practitioners were older or, anyway,
Yeah.
you know what I mean?
Yeah.
And so like maybe couldn't relate if I was like talking about my cycle.
Absolutely.
So I feel really comfortable with like some younger people who can relate. And I think that's something special about your clinic as well. And I don't know if I've told you, I think I've told you that before, but just wanted to point that out.
Thank you.
Thank you.
Yeah.
Yeah, we have all ages for practitioners, and thank you.
Yeah.
I'm very thankful that I got into acupuncture at a young age, because a lot of people choose it as a second career. So I just scored.
Well,
Yeah.
we definitely are going to have to wrap up here. So we're going to have you back on, because I still want to hear about how you guys do all the things. But to close out, can you guys share what wellness means to you?
I think from my journey is just really allowing yourself to heal from whatever it is that you're going through. And I think one of the things that I found a lot of relief on is allowing myself to, let me take care of myself. And I think a lot of people post-military, or a lot of men in general, they don't talk about their stresses or their depression or their anxiety. It's something that like I think we're still trying to make it a little bit more normal. And wellness is, for me, is just that. Like I've been able to find a lot of healing in allowing my wife to practice on me. But I think it's been an amazing journey to be able to control my anxiety, my depression, all those things that I went through after the military, and find the light at the end of the tunnel. So if you're going through any anxiety, any tough times, I think it's just healthy to allow yourself to, you know what, let me take care of myself. Let me stop for a second and take some time. So I think that's what
Beautiful.
wellness. Yeah.
I love you.
Aww.
Yeah. Yeah, wellness for me, I think it's just always trying to stay in balance and balance your mind, body, and spirit. That's definitely something I've learned over the years, to just be more mindful, more aware of where you are, be a little bit easier on yourself, and also accept help from other people, you know.
That's a good point. Accept help.
Yeah,
Ask
accept help,
questions.
ask questions. Yeah. It's out there. Yeah. And so you just have to be open-minded to go get it.
Yeah. And men and women of all ages can come to
Absolutely.
y'all's clinic. So where can we
Kids,
find you to come to you?
Yeah. Well, right now our baby location is in Houston Heights, but there will be many more in the future in our on our vision board. But in Houston, we also do telemedicine. So for anyone who doesn't live in Houston or can't make the drive or trip, we can support them through telehealth.
So the website is
www.templewellness.com, and that's TEMPL, so Temple without the E, wellness.com.
And the Instagram is the same?
Temple Wellness.
And Dr. Sarah, you have your page too?
Yes, on Instagram, Dr.Sarah Anzola.
And
I love that.
we're very central, so in the heart of the Heights, you can find us there.
Yeah, and if you haven't been yet, definitely refer WellnessForHou at checkout, and they'll give you $10 off for learning about them here and coming in to give it a shot. So refer WellnessForHou for $10 off your first appointment.
Give it a try.
Yes, thank y'all so much.
Thank you so much
Thank you for having us.
We'll have to have you back on.
For sure.
Please.